Question number 1. Which nursing principle focuses on respecting the patient's right to make their own decision? The correct answer is option A, autonomy. Question number 2. What is the first step in the nursing process? The correct answer is option B, assessment. Question number 3. Which infection is mainly prevented by proper hand hygiene before patient contact? The correct answer is option A, nosocomial infection. Question number 4. What is the primary purpose of documentation in nursing? The correct answer is option B, provide a legal record of care. Question number 5. Which electrolyte imbalance is most commonly associated with renal failure? The correct answer is option A, hyperkalemia. Question number 6. What assessment is most important before administering furosemide to a patient with congestive heart failure? The correct answer is option B, blood pressure and electrolyte levels. Question number 7. Which vaccine is contraindicated in immunocompromised patients? The correct answer is option B, MMR. Question number 8. What is the recommended compression to ventilation ratio for adult CPR? The correct answer is option B, 30:2. Question number 9. What is the first action for a nurse who finds a patient unresponsive with no pulse? The correct answer is option A, call for help and start chest compressions. Question number 10. Which type of isolation is required for a patient with pulmonary tuberculosis? The correct answer is option C, airborne isolation. Question number 11. Which clinical sign is most indicative of hypovolemic shock? The correct answer is option B, hypotension and tachycardia. Question number 12. What is the priority nursing intervention for a patient with acute asthma attack? The correct answer is option B, provide supplemental oxygen and monitor airway. Question number 13. Which laboratory test is most specific for myocardial infarction? The correct answer is option B, troponin 1. Question number 14. Which complication is most common after a central venous catheter insertion? The correct answer is option A, pneumothorax. Question number 15. What is the main purpose of a blood transfusion in anemia? The correct answer is option B, increase hemoglobin and oxygen carrying capacity. Question number 16. Which type of diet is recommended for a patient with chronic kidney disease? The correct answer is option B, low protein, low sodium. Question number 17. Which drug is commonly used as the first line treatment for type 2 diabetes mellitus? The correct answer is option B, metformin. Question number 18. Which nursing action is essential when caring for a patient receiving chemotherapy? The correct answer is option B, monitor for neutropenia and infection. Question number 19. Which clinical feature is most common in hyperthyroidism? The correct answer is option C, heat intolerance and tachycardia. Question number 20. Which intervention is most appropriate for preventing pressure ulcer in immobile patients? The correct answer is option A, frequent repositioning and skin care. Question number 21. Which assessment finding is most indicative of left-sided heart failure? The correct answer is option B, pulmonary congestion and dyspnea. Question number 22. What is the priority nursing intervention for a patient with suspected sepsis? The correct answer is option A. Administer IV fluid and antibiotics promptly. Question number 23. Which electrolyte imbalance is most commonly caused by prolonged vomiting? The correct answer is option B. Hypokalemia. Question number 24. What is the primary nursing responsibility before administering a blood transfusion? The correct answer is option A. Verify patient identity and blood compatibility. Question number 25. Which intervention is most important for a patient with chronic obstructive pulmonary disease experiencing dyspnea? The correct answer is option B. Position patient upright and provide oxygen as prescribed. Question number 26. Which clinical sign is commonly associated with hypoglycemia? The correct answer is option B. Confusion and sweating. Question number 27. What is the most appropriate nursing intervention for a patient with a nasogastric tube? The correct answer is option A. Verify placement before feeding. Question number 28. Which precaution is necessary for a patient with Clostridium difficile infection? The correct answer is option B. Contact isolation with strict hand hygiene. Question number 29. Which assessment finding is most indicative of increased intracranial pressure (ICP)? The correct answer is option B. Headache, vomiting, and altered level of consciousness. Question number 30. Which laboratory test is most specific for liver function assessment? The correct answer is option B. AST and ALT levels. Question number 31. What is the priority intervention for a patient experiencing an anaphylactic reaction? The correct answer is option B. Maintain airway and administer an epinephrine. Question number 32. Which type of shock is caused by severe blood loss? The correct answer is option B. Hypovolemic shock. Question number 33. What is the most appropriate nursing action for a patient with a stage 2 pressure ulcer? The correct answer is option B. Clean with saline and apply a sterile dressing. Question number 34. Which symptom is most characteristic of hypothyroidism? The correct answer is option C. Cold, intolerance, and fatigue. Question number 35. What is the first nursing action when a patient develops sudden chest pain? The correct answer is option B. Assess vital sign and ECG notify physician. Question number 36. Which lab value is most indicative of renal function deterioration? The correct answer is option A. Elevated creatinine and BUN. Question number 37. What is the priority nursing intervention for a patient with severe dehydration? The correct answer is option B. Administer IV fluid as prescribed. Question number 38. Which precaution is essential for a patient with measles? The correct answer is option A. Airborne isolation. Question number 39. What is the primary goal of pain management in post-operative patients? The correct answer is option B. Reduce pain to a tolerable level and promote recovery. Question number 40. Which nursing intervention is priority for a patient with a Foley catheter to prevent infection? The correct answer is option A. Maintain a closed drainage system. Question number 41. Which electrolyte imbalance is commonly seen in patients taking loop diuretics? The correct answer is option A. Hypokalemia. Question number 42. What is the most important nursing action for a patient experiencing severe bradycardia? The correct answer is option C. Prepare for atropine administration. Question number 43. Which clinical sign is most characteristic of Cushing's syndrome? The correct answer is option D, moon pace and central obesity. Question number 44. What is the priority nursing intervention for a patient with suspected deep vein thrombosis? The correct answer is option B, avoid massaging the limb and notify physician. Question number 45. Which nursing intervention is most appropriate for a patient with COPD during an acute exacerbation? The correct answer is option C, encourage deep breathing and coughing exercises. Question number 46. Which lab value is most indicative of diabetic ketoacidosis (DKA)? The correct answer is option C, blood glucose 250 mg per dl with ketones. Question number 47. What is the priority nursing action where the patient develops sudden shortness of breath and chest pain? The correct answer is option B, assess vital sign, administer oxygen and notify physician. Question number 48. Which symptom is most commonly observed in patients with hyperkalemia? The correct answer is option B, muscle weakness and cardiac arrhythmias. Question number 49. What type of isolation is required for a patient with chickenpox? The correct answer is option D, airborne and contact isolation. The correct question number 50. Which intervention is most appropriate for preventing falls in hospitalized elderly patients? The correct answer is option D, keep bed in lowest position and provide call bill. Question number 51. What is the primary nursing action for a patient experiencing hypovolemic shock? The correct answer is option A, administer IV fluid rapidly. Question number 52. Which lab test is most important to monitor in a patient on heparin therapy? The correct answer is option B, APTT. Question number 53. What is the priority intervention for a patient with suspected stroke, CVA? The correct answer is option B, maintain airway and oxygenation. Question number 54. Which nursing action is most appropriate for a patient with neutropenia? The correct answer is option C, maintain strict hand hygiene and limit visitors. Question number 55. Which symptom is most commonly associated with hypothyroidism? The correct answer is option A, fatigue and weight gain. Question number 56. Which electrolyte imbalance is commonly observed in patients with chronic kidney disease? The correct answer is option C, hyperkalemia. Question number 57. What is the first nursing action when a patient develops sudden hypotension after surgery? The correct answer is option B, assess vital signs and notify physician. Question number 58. Which intervention is priority for a patient with acute asthma attack? The correct answer is option A, administer bronchodilator and provide oxygen. Question number 59. What is the priority nursing action for a patient with suspected myocardial infarction? The correct answer is option B, monitor ECG and administer oxygen. Question number 60. Which precaution is essential for a patient with tuberculosis? The correct answer is option D, airborne isolation.